Why You Can't Sleep Tonight, Part 5, Depression and Insomnia. Hello, I'm Dr. Ninth Tail. If you're just joining us, I recommend watching the previous videos first. We've already talked about what insomnia is, why sleep is important, physical causes of insomnia, stress, and anxiety. Today we're going to discuss another very common reason people struggle with sleep: depression. When people hear the word depression, many picture someone crying all day or feeling sad every moment. But depression doesn't always look like sadness. Sometimes it looks like constantly feeling tired. Sometimes it feels like you just don't care about things you used to enjoy. Sometimes it feels like you're simply surviving each day. And surprisingly, one of the earliest signs of depression can be changes in sleep. Many people think depression simply makes people sleep more. Sometimes that's true, but many people with depression actually have insomnia. You may have trouble falling asleep. The nights feel endless. You lie awake, staring into ceiling, and when morning finally arrives, getting out of bed feels almost impossible. So, you're sleeping much longer than usual, yet you still wake up feeling exhausted. Friends and family may wonder why you're always so tired when you've been in bed for so many hours. That's because depression can affect both the quantity and the quality of sleep. Your brain may not spend enough time in the most restorative stages of sleep, so even if you technically slept, it doesn't feel refreshing. The cycle. One of the hardest parts is that depression and insomnia feed each other. Poor sleep can worsen depression. Depression then makes it harder to sleep. The worse you sleep, the worse your mood becomes. The worse your mood becomes, the harder it is to sleep. It becomes a cycle that's difficult to break. Maybe I'm just lazy. One thing I hear from patients all the time is, "I think I'm just lazy." Most of the time, they're not. Depression can make even small tasks feel overwhelming. Getting out of bed, taking a shower, answering a text message, cooking dinner. Things that once felt effortless may suddenly require tremendous energy. If you've ever felt guilty because you can't seem to do what everyone else can, know that depression often steals motivation long before people recognize they're depressed. What can help? If depression is affecting your sleep, improving sleep hygiene is still important. Try to wake up at the same time every day. Every morning, open the curtains and let some sunlight in. A short walk outside can help reinforce your body's natural sleep-wake cycle. If that feels overwhelming, don't worry about exercising right away. Simply step outside, first out of bed, then out of your room, then outside your house. Even standing outside for a few minutes is a good start. When you're ready, a short walk can help reinforce your body's natural sleep-wake cycle. Continue exercising regularly if you're able, even if it's just for a few minutes. And try to maintain social connections, even when you don't feel like it. Choose people who make you feel safe and supported. That may be a close friend, a family member, or someone you trust. Depression often makes people withdraw from others, but isolation can make depression even worse. If your symptoms are lasting more than a couple of weeks, interfering with work, relationships, or daily life, or you're finding it difficult to function, it's important to talk with your healthcare provider. Depression is a medical condition, not a personal weakness, and effective treatments are available, including therapy, medication, or a combination of both. CBT moment. Let's finish with another small exercise. If you're lying awake tonight and your mind says, "I'm a failure," or "Nothing is ever going to get better," ask yourself, what evidence do I have that this thought is completely true? Is there another explanation that I haven't considered? Then ask, if my best friend said this about themselves, what would I tell them? Depression often convinces us that its thoughts are facts. They aren't. Learning to question those thoughts is one of the core principles of cognitive behavioral therapy, and with practice, it can become a powerful tool. Thank you for spending a few minutes with me today. In our next episode, we'll talk about another condition that commonly disrupts sleep, PTSD and trauma, and why difficult experiences can continue to affect sleep long after the event has passed. Until then, I'm Dr. Ninth Tail. Sleep well and take care of yourself.